Hi everyone, I'm Heather Wen, the founder and practitioner at Arizona Healing Alternatives. On this channel, you'll find several videos, what I like to call aha moments. Some will be shorter and some will be longer, where you'll find issues that impact your health. So whether you decide to use Western medicine, alternative medicine, or even a mix of both, I'm passionate about you knowing what your options are. In today's aha moment, we're going to be talking about the differences between sadness and more serious issues of things like depression. I'm going to be talking about kind of the definitions, the causes, and then we'll go through options that you have to deal with that if in fact you are dealing with depression. So stay tuned. So let's talk about the differences between just feeling sad or stressed and actual depression. Now, I'm not a trained therapist, I'm not a psychiatrist, I'm not a life coach. However, the years that I spent as a women's healthcare nurse practitioner, specifically doing a lot of prenatal care and seeing a lot of women postpartum, we were trained in how to identify the difference between just what's called the baby blues or sadness due to hormonal fluxes after someone has a baby versus postpartum depression versus postpartum psychosis. Okay, very different things, very different treatments for those. So this is where I'm coming from in this video. When we look at it, let's kind of talk about those differences. Reason why I'm covering this topic is because in this year 2020, we've had lots of stress, lots of things that have been going on, lots of changes, lots of financial stresses, emotional stresses, and I've covered those in some other videos. But basically, with that, how do we tell the difference between how it feels on a day-to-day basis dealing with that versus depression? Because what I've also read is that the rates of depression have gone way up in this time frame, and so much so that many people are needing antidepressants, which is a very valid way of treating this stuff. So let's look at that. What are kind of the symptoms? How do I tell the difference between whether I'm just having a bad day, stressed, or whatever? And please know that this list that I'm describing is not an extensive list. So there are many other different signs of depression and a lot more extensive lists. I'm just going to touch on a few in the highlights and things that I've seen in my practice. But it's not an extensive list. If you need that, please, seeking out a practitioner can help with that. Well, the first thing is the length of time some of these symptoms last. Okay, so first of all, when we look at length of time, we're looking at if symptoms that I'm about ready to describe last for longer than 2 weeks daily on a consistent basis, then we start to get more concerned. So what we're seeing is, first of all, it's completely normal to cry and get upset, have feelings like, oh my gosh, I really just don't feel like getting out of bed today. I just don't feel motivated. I don't want to do anything. That's normal. If that happens for like a day or two, that's okay, especially with what is going on right now in the world. Normal. What's not normal is every day it feels like I don't want to get out of bed. And this lasts at least 2 weeks. I don't want to get out of bed. You can even have sensations in your body of feeling heavy, weighted down, and in fact have a lot less energy. Now, most of us have a lot less energy because we've had such great changes in our lives and haven't been able to do our normal activities. But I'm talking about it almost feels like a weight is on your whole body. Everything seems almost like in slow motion. It's difficult to concentrate. It's difficult to think. It may be even hard to make very basic decisions that you've always been able to make. That's part of it and can happen. And like I said, upset and crying is okay. But when you can't stop crying, when every day is like this and it's lasting for another couple weeks, then where it gets to be more serious, everybody from time to time may feel like, oh, I just don't know if it's worth it. I'm just having such a bad day. I just don't even want to wake up in the morning. Okay, that is normal and that can happen. But when it starts becoming, I don't want to live, my life's not worth it, you start to feel bad about yourself and start feeling like, oh my gosh, I'm a terrible person. I can't believe I can't do this. And you're just really, really hard on yourself. And you feel like you're not competent in the world. And you start to have what are called suicidal ideations. That means you're thinking about suicide a lot. Like whether you want to hurt someone else, that's homicidal ideations. Whether you want to hurt someone else or yourself, suicidal ideations. Having those thoughts is one thing. Okay, but even if you just have those thoughts, you need to reach out because somebody really needs to evaluate because where it gets more serious is where you start to think about it so much that you actually start thinking about or have a plan as to how to get it done. That's where we know it's really, really getting serious, okay? So I want people to know that. I think it's very important. Then, like I said, when I was dealing with postpartum patients, then it goes into that postpartum, it can be that psychosis, things like that. That's where you may be hearing or seeing things that actually don't exist. That's a different level of this. What we're going to focus on is that depression. Why do those things happen? And once again, please, if you are having trouble or those types of feelings, it is incredibly important that you reach out to a medical practitioner or you call 911 immediately, because sometimes those thoughts can take over, and the last thing you want to do is do something that is permanent, that's not okay. So either 911, you call that, because those are cases when you start to feel that way all the time, well, you really need to start considering some other options up to and including Western medications. So, and there are suicide hotline numbers, there are things like that that you can find, but you need to reach out immediately and have somebody with you. So please. Now then, what causes this? There are many, many different causes for those types of feelings. One of the causes is simply situational. So things happen. COVID-19 is a situational thing. It's a situation that's happening that's changing people's lives, that's causing a great deal of problems. So with that, there's a situational one that can cause depression. Other things that can cause depression, certain medications that people are on can cause depression, and that's something to discuss with the person who's prescribing that for you. That can happen. Other things like alcohol. Alcohol is fine if you have it a little bit once in a while to de-stress, but alcohol is actually a depressant, okay, on the nervous system. So with that, more of that can cause somebody to feel depressed. There can be hormone imbalances. That's a big one. Just like when I was dealing with patients that had postpartum depression, it was because their hormones were rapidly changing after having a baby. So hormone fluctuations can lead to feelings of depression, as well as thyroid problems, other medical conditions that can cause that. So what are your options and what to do about this? Some of the options is reaching out to your primary care person, whether it's your nurse practitioner, whether it's your primary care person. Very important to reach out to them and talk to them about that, because they can be the ones that can run blood tests and see if there's a problem in the blood test creating an imbalance that's creating this sort of depression. Or they can refer you to other counselors or psychiatrists, psychologists, things like that that you may need. If it's something that is on that needs some kind of medication, it can work very, very well with things like naturopaths and naturopathy, because what you can do is there are supplements that can also help with depression, and there's hormone replacement with either regular nurse practitioner practitioners or also naturopaths or other things like that that can help with that if you want to go more of the natural route, okay? And I always recommend that with naturopaths. The other thing you can do, there are things that I do. I work with people a lot, and there are many people that I see in my practice that I actually send them to get supplements or medications in addition to what we're doing, which is doing some of the neuroemotional reprogramming, and also other corrections that I do via applied kinesiology, hypnosis, and other things that can help with anxiety and panic, things like that, that sometimes can lead up to depression. But yes, I see many, many patients that we do both. So don't cut off your options as to what could work for you, because your body is different from everybody else's body. So what works for your body may be entirely different. So what I recommend is please, please, please reach out, because there are many different reasons where things go from just sadness and feeling blue some days to feeling out and out depression. And sometimes there are ways it goes into bipolar depression, other things that really need medication management and or medication or supplement management. Thank you so much for listening to this. If you enjoyed what you have heard, please feel free to hit the subscribe button. And there's also a notification bell there so that when new videos come out, you'll be notified. Once again, please, please, please take care of yourself. Know what the differences are between just sadness and being upset. And I'm going to be talking about in another video, motivation, just decreased motivation versus the signs of serious depression. Please take care of yourself and stay well.